We will now move on to the next item of business, which is second stage of the Health Miscellaneous Provisions Bill 2016. And I firstly call on the Minister for Health, Deputy Simon Harris, to move the technical motion that the second stage be taken now. Minister, you move that it be taken now? You move. Will you now propose that the bill be read a second time?
I propose.
Thank you very much. Is that agreed? It's agreed. Now, let's hear your second stage speech. Minister, please.
Thank you very much, Cian Corla, and I've moved, obviously, that this bill be now read a second time, and I'm very pleased to have the opportunity to address the House on the second stage of the Health Miscellaneous Provisions Bill, which was published in January this year. The bill has 5 parts with 16 sections. Part 1 sets out the title of the bill, and all parts will be commenced on enactment. Part 2 amends the Irish Medicines Board Act 1995 to allow for the payment of fees to members of the Health Products Regulatory Authority, formerly the Irish Medicines Board, as such fees are payable to the members of other boards. Currently under Section 8.7 of the Irish Medicines Board Act 1995 as amended, only the chairman of the authority is entitled to a fee. There is an onerous responsibility and a significant time commitment placed on members of the authority, and we wish to attract the highest calibre of people to apply to be members of such boards. Some people may be self-employed, and without the fee that will be paid under this amendment, it would be very difficult for them to give the time commitment involved. There is, you'll be glad to know, Cian Corla, no additional cost to the Exchequer relating to paying board members of the authority, as it is mainly a self-funding body. The fee approved for payment to each board member is in keeping with the guidelines issued by the Department of Public Expenditure and Reform, is €7,695 per annum, and the additional cost to the authority will be up to approximately €61,560 per annum. However, some members may still choose to waive their fee, and the one person, one salary will also apply to members who are in receipt of a salary from the public service. Part 3 of this bill aims to amend the Nursing Home Support Scheme Act of 2009, otherwise known as the Fair Deal Scheme, in order to exclude certain ex gratia payments which have been or will in the future be made to people under specific schemes approved by the Government for the purpose of assessment of means under Fair Deal. This is a very important amendment. A number of groups within the state have been in receipt or will receive ex gratia payments as a result of Government decisions which acknowledge the hardship, the pain and the suffering which the people affected underwent. The schemes being covered in this legislation are the Lord's Hospital Redress Board, involving 119 women, the Lord's Hospital Payment Scheme, which compensated women who were excluded from the Redress Board on age grounds alone. This relates to 47 women. The Surgical Synphysiotomy Payment Scheme, which has made awards to around 400 women, and payments made either by the Government or by the German Contergan Foundation to 32 Irish survivors of thalidomide. The bill will also amend Section 36 of the 2009 Act, giving regulation-making power to the Minister to allow for an exemption for other similar groups that may receive ex gratia payments from being taken into consideration for support under the Fair Deal, provided such schemes have been approved by Government. This is the way that such exemptions under various social welfare schemes are managed also by the Department of Social Protection. The key principle underlining this legislation is that a person should not be disadvantaged because of acceptance of a payment under an ex gratia scheme which has been approved by Government. Fair Deal applications are mean tested, and the people themselves or their partners could be over the income threshold for availing of Fair Deal supports because of receipt of their ex gratia awards. The proposal will not give access to free nursing home care to the various groups, but it will mean that the payments they receive under Government-approved ex gratia schemes will not be considered as part of their income for the purpose of assessment under Fair Deal. Part 4 of the bill amends the Health Pricing and Supply of Medical Goods Act 2013, Part 1 of Schedule 3. This amendment is required to ensure that over-the-counter products which do not require prescription can continue to be available under the GMS and community drug schemes if so required. This will ensure over-the-counter medicinal products, including emergency contraception and nicotine replacement products, can continue to be reimbursed to medical card holders after May 2018. The amendment proposed will allow the HSE to not apply the criterion regarding prescription-only medicines when considered appropriate in the interest of patient safety or public health. Another amendment proposed is to paragraph 1E of Part 1 of Schedule 3 of the Health Pricing and Supply of Medical Goods Act 2013, which currently specifies that medicinal products must have a marketing authorisation referred to in paragraph A of the definition of authorisation holder in Section 2.1 of the Act. The reference to paragraph A is unintentionally restrictive, as it excludes products which are authorised by the European Medicines Agency and parallel imports. Parallel importation is the importation from an EU member state or a country within the EEA of a medicinal product which is essentially similar to a product already authorised in Ireland by an importer who is someone other than the importer appointed by the marketing authorisation holder of the product of the Irish market. The parallel trade of medicinal products is based on the principle of the free movement of goods within the internal market of the EU. It was never the intention to exclude such products, and any such interference or inference would be contrary to free trade principles. The explanatory memorandum which accompanied the bill noted that allowing reimbursement of certain over-the-counter medicines under the GMS and community drug schemes will give rise to some additional cost from loss of prescription charges over time, but this is not expected to be significant. However, this is actually not correct. My officials have now confirmed that there are in fact no additional costs arising from the amendments proposed in Part 4 of this bill. My department will ensure that this is clarified in any further briefing on the draft legislation. Part 5 of the bill seeks to amend sections 2, 7, 9, 10, 13 and 14 of the Public Health Standardised Packaging of Tobacco Act 2015. Section 2 of the Public Health Standardised Packaging of Tobacco Act 2015 sets out the definitions used in the Act. Section 7 deals with retail packaging of cigarettes. Section 9 with roll-your-own tobacco products. Other tobacco products, including cigars, are dealt with in Section 10. Presentation of tobacco products is dealt with in Section 13, and features of retail packaging in Section 14. The regulation of the appearance of tobacco packaging is intended to contribute to improving public health by reducing the appeal of tobacco products to consumers, increasing the effectiveness of health warnings on retail packaging, and reducing the ability of the packaging of tobacco products to mislead consumers about harmful effects of smoking. And if I may say, Kim Corley, this country has led the way through successive governments in relation to tobacco control and moving towards tobacco-free Ireland. This is the next really important step in this regard, and this legislation is an important part of that. The Act currently provides for a number of elements to be prescribed by the Minister, including the colour of the outer and inner surfaces of tobacco packaging, the form and manner of barcodes, and the manner in which a name may be printed on tobacco products. The amendment to the 2015 Act put forward in this bill are to provide by way of regulations for a number of other matters relating to the appearance of tobacco packaging. Some of these matters are technical and practical in nature, and some seek to provide basic information to the consumer. These amendments will permit the following elements to be included on tobacco retail packaging: text to indicate the type and weight or number of tobacco products contained in the package, the inclusion of a tab to allow consumers to reseal the package, the inclusion of a calibration mark which may be necessary for the automated production of the packaging, the contact details of the manufacturer, and additional information on cigar bands. This Health Miscellaneous Provision Bill serves to make important changes to 4 acts Cathaoirleach in the interest of equity, or in some cases the interest of patient safety. And of course the tobacco legislation is to protect public health. I really look forward to the passage of this bill so that we can actually get on with making these improvements in relation to the Fair Deal scheme, a scheme that's being led by my colleague Minister McEntee, and getting on with the job of introducing the standardised packaging for tobacco being led by my colleague Minister Marcella Corkin-Kennedy, which is the next really important step in terms of our move towards tobacco-free Ireland. So I very much commend this bill to the House, and I hope that on all sides of this House we can agree to support this bill and pass it as quickly as possible through the Oireachtas so we can get on with making these important improvements.
Thank you, Minister Harris. Minister McEntee.